Hey friends, Ehrica here from Milestone Mom, Pediatric Developmental Therapist for the Early Intervention Program. So we are in the middle of a series called Baby Sleep. This is our third video that we've done. This is a series of 5 videos plus a bonus video. So there's 6 in all. I was looking through my channel and one of my top viewed videos is actually one on baby sleep. So I've added it to this playlist. If you want to know how to access all 6 of these videos, you can either go to the description underneath this video on YouTube, or if you're listening to this on a podcast in the show notes, or you can go to my YouTube channel under playlists and look up baby sleep, newborn sleep. It's going to be under something like that. I know I've mentioned some titles throughout this series. Sometimes the titles change as well, just depending on different search terms and what people are looking for. So as long as you go to newborn sleep, baby sleep, or look at the links below this video, then you will see everything that I've done in this series, which is 6 videos. Also, they're not in any particular order, so you can watch them however you want. If you land on video 5, that's fine. You don't have to watch number 1 first. And I've created a free printable to go along with these videos on baby sleep. So you will find that under each one of the videos in the description box, along with some other things. Always check my description box to see what I'm offering. A lot of freebies, some paid workshops if you're interested in those. But let's go ahead and keep going. So today, the video that we're doing is on sleep regression. Now, I know that throughout the other videos, I have talked about sleep regression because it kind of intertwined with all of the different sleep videos that I've done, because that is a common problem that parents deal with. But this one is specifically on sleep regression. So we're going to talk about what sleep regression is. And again, if you see me looking over here, it's because I'm looking at my notes. Remember, in some of those videos, I talked to you about there is a reason for sleep regression at certain ages and why this happens. We're going to talk about that and signs of sleep regression and how to handle it. So let's go ahead and get started. Now, as a parent, just when you think you've got your baby's sleep under control, you may encounter a sudden and unexpected change in their sleep pattern. This is what we call sleep regression, and this is what we've been talking about throughout this series. It's very common, but yet a challenging phase for your baby and for parents as well, especially babies who are previously sleeping well, and they all of a sudden begin waking up more frequently at night, or even resisting naps or having difficulty falling asleep. Some sleep regressions can leave parents feeling very exhausted and very frustrated, but understanding what causes them and how to manage them can make a world of difference. So in this video, we'll dive deep into what sleep regression is, why it happens, and how you can handle it to ensure that both you and your baby can continue to get the rest that you need. So, what is sleep regression? And we've been talking about this a lot, but in a nutshell, sleep regression is a temporary disruption in a baby's sleep pattern, typically occurring around key developmental milestones, which we'll get into. It often results in more frequent night wakings, shorter naps, and an overall decrease in the quality of sleep. So, while these regressions can be stressful, they are a normal part of baby's growth and development. Sleep regressions are most commonly observed at specific ages, and we're going to go through those specific ages. The first sleep progression can happen around 4 months, and this typically is tied to changes in a baby's sleep cycle. This can occur because babies begin to sleep for shorter periods and may wake up more frequently as they transition between sleep stages. And I am over here reading some of my notes just so I don't forget anything. Signs that this could be happening is frequent night waking, shorter naps, falling back to sleep without help. Some of the things that you could do is focusing on establishing a consistent bedtime and helping your baby learn to self-soothe to ease through this regression. So we've talked about this in other videos, how important consistency is with your routine and not starting to soothe them in a way that they hadn't been soothed before. So if they were able to wake and self-soothe and fall back to sleep, now's not the time to start getting them out of the crib and feeding them or rocking them. And then the next one is 6 months. 6 months is when another sleep regression typically happens. And this is usually because babies are becoming more aware of their surroundings and may be developing separation anxiety. Now, some signs that this is happening At 6 months, increased fussiness at bedtime, clinginess, and waking up frequently to seek reassurance. Some of the things that you can do for a 6-month-old who's going through this is just to reassure your baby with comforting bedtime routines, because they do like routine and structure, such as gentle rocking or soothing sounds, that sound machine that we were talking about. But avoid creating new sleep associations that require your constant presence. So again, if they've been able to self-soothe before, don't start coming in to give them a bottle or to rock them. Obviously, give your baby comfort and reassurance to let them know you're there, but don't start any new routines. Stick to the one that they're familiar with. And then the next one usually happens between 8 and 10 months. And this one is typically linked to major motor and cognitive milestones like crawling, standing, and babbling. I mean, if you really think about it, between 8 and 10 months, they're really going through a lot of different developmental milestones. They're learning, they're growing. Some signs of this may be happening to your 8 to 10-month-old. Again, difficulty settling down at night, waking up to practice new skills, and resisting naps. Believe it or not, they're already starting their independent journey. How to handle this? Again, encourage motor movement, practice in those motor skills during the day to reduce the desire to get up and do that at night. Maintain, again, a consistent sleep routine and provide a calming environment to help your baby unwind. Okay, and then the next one happens typically around 12 months, and you can probably imagine what's going on with a 12-month-old. They're busy, they're on the go, whether it's pulling to stand, cruising along furniture. Some may be walking by now. Some are very mobile with crawling. So they are very, very motor enriched at this age. So this definitely often correlates with the transition from infant to toddler and new challenges that they are facing. Some signs that this could be happening is increased restlessness at bedtime, frequent night wakings, and resisting naps or nighttime sleep. So how to handle this? Again, sticking to a regular routine. Consistency is so important. Provide plenty of opportunities for physical activity and give your toddler time to wind down before bed because they are very, very busy. Okay, we have 2 more. So around 18 months, this also happens. As toddlers assert their independence, their sleep may be disrupted by growing pains, separation anxiety, or even just development. Some signs that this could be happening as well. Again, bedtime resistance. You're kind of seeing the trend here. Nighttime wakings, nightmares might come into play here, and increased clinginess during bedtime. So what you can do for your 18-month-old is just provide a lot of reassurance and a calming bedtime routine, acknowledge their fears, and gently enforce bedtime rules. And consistency is key to helping your toddler feel safe and secure. And then the very last one typically happens around 2, and toddlers at this stage may experience sleep disruptions due to language development, potty training, and a sense of independence. Now, each child is unique, and some may not experience every sleep regression, while others might struggle more frequently. I've even had moms asking me about 2-month sleep regression, which we did not go over. So it does definitely happen at different times, but I'm hoping that I'm covering my bases here. Your 2-year-old, they're immersed in learning. They've moved on from gross motor to that language development piece. They're also learning how to assert their independence. So things that might warrant or might look like sleep regression at this age is bedtime battles. And they do get a little bit stronger because you have very independent 2-year-olds at this point, waking up to use the potty, sleep disruptions due to dreams or fears. And at this time, some toddlers are even refusing to take naps, which could affect their bedtime schedule as well. Again, just encourage calm, language-rich activities before bed, reading books, talking about the pictures that you see in the books, establishing that consistent bedtime routine, incorporating potty training into bedtime routine. So if they are interested in potty training, this is about the age they become aware and interested. Some kids at this point are even waking up dry. So if that is something that you need to incorporate into your bedtime routine, having them go potty before bed, and first thing in the morning, then you need to incorporate that. And then also providing a sense of security and routine to help ease the transition. Very rarely are kids doing this to just be defiant. Their bodies are going through a lot, which signals sometimes sleep regression. Okay, so the next thing we're going to talk about is why sleep regressions happen. We've already talked about the different stages that sleep regression does happen and why that could be a reason per age. But there are a couple other factors that I wanted to talk about that could be causing this. So I actually have 5. So the first one is developmental milestones. Now, sleep regressions often align with important cognitive and physical milestones that we just talked about. For example, at 4 months old, a baby's sleep pattern becomes more like an adult's, shifting from short bursts of deep sleep to more cycles of light and deep sleep. Similarly, at 8 to 10 months, babies may experience disruptions as they learn to crawl. So one could be teething. Teething pain can cause discomfort, making it hard for your little one to settle down. Separation anxiety, we kind of already talked about that around that 6 to 9 month mark. Babies become more aware of their caregiver's presence and may wake frequently to check in to see if you're nearby. Increased awareness. As babies grow older, they become more aware of the world around them. They may even wake up in the middle of the night excited about their new skills, like crawling or talking, or simply curious about their environment. And the last one is growth spurts. So physical growth spurts can lead to increased hunger, making babies wake more often for feedings during the night. And again, this goes back to definitely don't starve your baby. That's not what I'm saying. But if your child is able to go back to sleep without starting some of those new routines, like feeding at 4:30 in the morning, see if you guys can work through that instead of starting some new habits that are harder to break. And just to recap, some signs of sleep regression, which we've kind of already talked about, it can feel frustrating because your baby's sleep might have been progressing well, and suddenly it seems like everything is falling apart. So some common signs of sleep regression include increased night waking. Your baby who previously slept through the night now is actually waking up, sometimes multiple times per night. Shorter naps is also one of them. Naps that used to last an hour or more may suddenly be cut down to 20 to 30 minutes. Fussiness during bedtime that all of a sudden is there that wasn't there. Your baby may resist going to bed, crying, or becoming fussy when it is time to sleep. And then also difficulty falling asleep. It may actually take longer for your baby to settle down and fall asleep at night or even during naps. And changes in appetite. Some babies might become hungry during sleep regressions, waking more frequently to feed. Okay, so I've kind of already talked about this too, but how do we handle sleep regression? Sleep regression can be tough, but there are ways to navigate this challenging period and help your baby and yourself get back on track. So, my number one tip is stick to a consistent routine. A predictable bedtime routine is one of the most effective ways to combat sleep regression. Babies and toddlers thrive on routine, and having a consistent pre-sleep routine can help signal to your baby that it's time to wind down. A soothing routine might include bath time, a gentle massage, reading a bedtime story, feeding, lullabies, or soft music. The key is to keep it calm and consistent every night. Avoid introducing too many new elements during a regression, as this can create confusion for your baby. Now, number 2, create an ideal sleep environment. And I want you to ensure that your baby's sleep environment is conducive to rest. The room should be dark, quiet, and at a comfortable temperature. Even using white noise machines can help drown out any external noise that might disrupt your baby's sleep. It's also really important to encourage self-soothing. So teaching your baby to self-soothe can make a big difference during sleep regressions. While it's tempting to rush in at every peep or every cry, allow your baby to try and settle themselves can help them learn to fall back asleep on their own. Start by putting your baby down drowsy but awake so they can practice falling asleep independently. Gradually reduce the amount of rocking, feeding, or comforting that you offer at bedtime. This doesn't mean leaving your baby to cry it out. Rather, it's about giving them space to practice self-soothing skills, which is very, very important. I also want you to be patient and responsive. So sleep regressions, like I said, are tough, but they are temporary. During this time, it's important to stay responsive to your baby's needs while remaining patient. Comfort your baby when they're upset, but avoid creating sleep associations, such as always needing to be rocked to sleep. That might be hard to break later on. Now, if your baby is teething or going through separation anxiety, extra cuddles and reassurance can be helpful without drastically altering the bedtime routine. Number 5, adjust naps and bedtime. During a sleep regression, it might be helpful to adjust your baby's nap schedule or bedtime slightly. If your baby is taking shorter naps, consider adding in a short additional nap to help them catch up on missed rest. If your baby is waking up earlier in the morning, you might try moving their bedtime earlier to prevent overtiredness. And lastly, don't be afraid to seek help. So if your baby's sleep regression seems particularly difficult or prolonged, it may be helpful to consult with a pediatrician or sleep consultant. There could be other underlying factors such as reflux, sleep apnea, or other medical conditions that are impacting your baby's sleep, especially if this is something that has been going on. We are talking about sleep regression, so this means that your baby has actually gotten into a fairly good routine and has kind of backslid a little bit. But if you are dealing with a baby who is constantly fussy, who is just unable, even a child who is, 2 years old, who is just unable to turn themselves off at night, laying in bed for 2 hours and not even crying, just laying there. And then maybe your little one is able to go to sleep, but not stay asleep. And they're 2, it may be some sort of sensory related thing versus like a sleep regression. So always make sure you check with your pediatrician. And I do have videos on the early intervention program if you're interested in that. Again, you can go to Milestone Mom on YouTube and you can type in early intervention. Okay, guys, that is it for video 3. I hope this has been helpful for you. Just remember that sleep regression is a normal part of your baby's development, though it can be a difficult phase to navigate. I totally understand. But understanding why sleep regression happens and how to handle them with patience and consistency, which is key to making it through this tough time. And then also remember that this phase is very temporary and your baby will likely return to more consistent sleep routines. And if you are going through a sleep regression right now, I just want you to hang in there. You're not alone, and better sleep is on the horizon. And again, don't forget to snag your free baby sleep resource that is in the description below. And if you are interested in more of these sleep videos, those are also in the description. And as always, I appreciate you, and I will see you in the next video.